Hi, my name is Cora Wilkins, and I'm a member of the University Honors Program. So we're just going to jump into this presentation. The World Health Organization recommended shutting down countries for quarantine shortly after COVID caused a pandemic. They adopted these restrictions to protect individuals' physical health, but the implications of the mental well-being of individuals were beyond expectations. Quarantine left many individuals struggling with mental health, but healthcare workers by far endured more struggles, such as higher workload, inadequate testing, limited treatment options, and insufficient personal protective equipment, even though they were dealing firsthand with COVID cases. For these reasons, it is vital for the healthcare workers to find a strong and effective coping strategy to be able to deal with all this stress, such as humor, specifically COVID humor, which is typically considered dark humor. However, it still provides a sense of relief and togetherness for the healthcare workers that are fighting COVID. According to Buschetti, humor is thought to be one of the highest defense mechanisms, which helps explain why so many healthcare workers would choose to use humor to cope with something as stressful as, first of all, their job, but also more than their job, something as stressful as COVID. He further explains that even though COVID humor is considered dark humor, it does not always revolve around the offensive themes that typically characterize the genre of dark humor, such as death and illness. In addition, darker humor has been found to be used by people that cope that by people to cope when they experience high secondary trauma stress, such as sickness, death, or abuse consequences as daily work stressors. Doctors, social workers, and detectives specifically see a bunch of this, as well as some other professions. Obviously, in a pandemic, sickness and death become all too common, especially for this field of study, healthcare, where it's already very common. And in addition to seeing firsthand at work the effects of COVID, they go home to turn on the news and watch a daily toll of those that are infected and have died from COVID. So it's very hard for them to escape from this stress that they're seeing. Using a strong defense mechanism like humor is vital because of this. Gonzalez's study found that nurses acknowledge more frequently both making use of humor or distractions to cope with the emotional burden associated with COVID. Ms. Butterfield states it is unlikely that mentors teach students to use humor to cope. But since healthcare requires healthcare workers to make some kind of connection with the patient to establish a trust, this can easily be accomplished through humor. So as they use more humor to establish more connections with their patients and establish that trust, it becomes more natural for them to just use humor in their everyday conversations. And as it becomes more natural for them to use humor in their everyday conversations, it will get more natural for them to just cope with humor. And as they cope with humor, as Beth Butterfield states, people with high humor orientation, which is a sense of humor or how funny they think of themselves, will seem to select humorous messages that do indeed improve a situation, which takes us on to relief theory, because it will provide some kind of relief to just laugh. Relief theory, in terms of COVID humor, is used to describe any humor that is used to alleviate stress, which allows them to continue delivering patient care. Buschetti states that the emotional processing of COVID-19 humor could contribute to the down-regulating the negative feeling and mitigating the stress induced by the COVID-19 outbreak, which may help make the problem seem more manageable if it doesn't seem nearly as negative, which will make them feel like they can take care of it and they won't be as stressed so they can deliver better patient care. Darker humor may also simply act to blur the true source of stress, even if it's just for a minute. Booth Butterfield states that for the person coping, the process of making a humorous statement may focus the individual outward toward the receivers and away from their own internal distress. So when they return to what was stressing them out, they have a clearer head. Continuing on, Booth Butterfield states that the use of social support, including maintaining a strong supportive network of coworkers, remains one of the most important factors for reducing secondary trauma stress. COVID may have impacted healthcare workers' normal social support because people are quarantining and they're moving all these healthcare workers around to new fields or new departments so that they can try to spread all the skill around to help as many people as they can, which means people may not see their normal social support as much as they would like to. And this is where humor comes into play, because using humor to cope will increase the social attractiveness, which will help to build a new social support. Cron found that the positive side of humor enhances effectiveness, increases workplace cohesion, and reduces burnout. Typically, positive humor is the safest humor to use since it's harder to offend someone with. However, because doctors and nurses experience the trauma that accompanies treating the COVID pandemic, they may experience similar effects using COVID humor as many places would using positive humor. Because COVID humor has raised similar fears for so many people, this COVID humor may also be able to alleviate some stress in the patient and the doctor. PTSD has been found to affect 96.2% of patients hospitalized with COVID. Moreover, another study found psychological distress and PTSD among health professions treating COVID. So, COVID humor on the internet has been seen as an act of social bonding for people that were quarantined, which means one could reasonably assume that COVID humor, when talking to someone face to face, would work in a similar fashion. And it may allow the doctor and the patient to relieve some of that stress that they feel from being in the hospital and being around all of this COVID trauma. However, doctors have to be careful with who they use this around and which patients they use COVID humor around and which ones they don't. Because an effective and mature coping mechanism permits the expression of emotion without individual discomfort and unpleasant effects upon others. Altman writes about some possible concerns that healthcare workers using cynical humor may run into. He suggests that the humor may divide coworkers that fail to see the humor in a dark joke, or it could negatively influence the treatment of a patient because the healthcare worker uses it to ignore personal biases or as a diversion from more complex problems or limitations in patient care. And while these risks are valid, Butterfield counters this, saying that humor helps to facilitate one's ability to establish social networks and employ communicative strategies that actually reduce or eliminate negative affective states. Moreover, Crown found that there seemed to be an understanding to only use dark humor or COVID humor around people that would appreciate it. So among the doctors, they would use it, or among with the nurses, but to censor it when they are around people that might find it more disturbing, such as clerks, custodians, or some patients. Another study with Australian child abuse investigators found that humor was never used at the child's expense. So no matter how much cynical and dark humor they used, it did not negatively affect them. It did not negatively affect their performance in their job. So they could use the dark humor, cope with it, and they could still perform their job just as effectively as using positive humor. They just felt less stress. So one could reasonably assume that the same applies for healthcare professionals, that they could use their COVID humor, they can use their dark humor, but it's not going to negatively affect the treatment of their patients. So even though COVID humor is considered dark humor, healthcare professionals may have used it to provide protection from the stress and isolation of a situation with which they could not currently cope. COVID. Although this darker humor needs to be centered around some people, it still stands as a large reason why healthcare professionals have been able to endure this brutal outbreak for over a year now. More research needs to be done to find better ways to cope for doctors that may struggle to be funny. And research can also be done to find how coping strategies have changed before, during, and after the pandemic. But for now, humor remains a very strong and prominent source of coping for many healthcare professionals. Thank you.